pledge will be led by the gentlewoman from Texas, Miss Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the real. The ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Bernice Johnson.
Hello, and welcome to the Capitol Report this week. My guest today is Judith Solomon, and she's a senior fellow at the Center on Budget and Policy Priorities. She specializes in Medicaid and S-CHIP issues at the state level, and today she and I will be discussing health care reform and what it means to Texas. Prior to her work at the Center on Budget and Policy Priorities, she was a senior policy fellow at Connecticut Voices for Children and executive director of the Children's Health Council. She graduated from the University of Connecticut and received her law degree from Rutgers University School of Law. And I'm so delighted that she's with us today. Thank you for coming. Tell me a bit about where we are with this system now with our children.
Well, in the current system, actually, we're doing a better job at covering children than we are adults. Congress passed the legislation reauthorizing the Children's Health Insurance Program last year, so children do have, in general, more coverage than adults. The real problem I think we're focusing now on is the fact that overall we've got over 47 million people who are uninsured in the country, many in Texas, as well as costs that are increasing faster than people's incomes and government revenues.
Well, I know that in Texas we have quite a number of working people that do not have health care coverage, and up into the millions. And it's disturbing because we keep hearing these scare stories about what will happen if we pass health care reform. It brings you back to the voices of 1993, and where I could not put together what was being said versus what I was reading. And so, and it still troubles me a bit. But how do you perceive, as it currently is projected now, to see a change for the children or the some type of insurance coverage for the working poor?
I think in large part that's where there is some general agreement about how to approach reforming the healthcare system, and that is to let people who have coverage, who are comfortable with their coverage, keep it. Many of those people are people who do have coverage through their employers. But the need is to figure out how to bring affordable options to those who don't have it. And that includes mostly people who can't afford it, but also a number of people who, even though they may be able to afford coverage, can't buy it because they've got chronic health care conditions. They don't get coverage through their jobs. They really can't get it in the individual insurance market. So I think where we're going is really a system that has three parts. It will build on the current Medicaid program and CHIP program for low-income people, and for the first time, all low-income people, mostly people with income below the poverty line, will be able to get coverage through Medicaid. Right now there's a large group, and many in the working poor group that you mentioned, that are left out because Medicaid does not cover adults who are under the age of 65, who don't have a disability and don't have children living in their homes. Doesn't matter how poor you are, doesn't matter if your employer doesn't provide coverage, you can't get Medicaid. So this will change, and everybody with income below a certain level will be able to enroll in Medicaid. That's sort of the first step. The second step is keeping the employer-sponsored insurance system and actually strengthening it. And the third is creating new options for people who are not eligible for Medicaid, many of the working poor, where they can go into things we're calling health insurance exchanges, where they will have a variety of options available to them in a way that's transparent, where they can compare what the plans offer and what the prices are, and where insurers will have to sell insurance to people regardless of their health care conditions. So I think it's the new opportunity for everybody to have a chance to get coverage that's quite significant.
Now, is this what is being labeled as the public option?
The public option is really part of the exchange. It will be one option offered in the exchange alongside private insurance plans. So when people go into the exchange, that's where you will be able to get subsidies if you can't afford coverage on your own, people below a certain income level. And they will choose from the public plan or private plans. A lot of people have expressed concern, a lot of insurance companies, that they won't be able to compete with this public plan and they will eventually go out of business. But that's not what the Congressional Budget Office found in looking at the House bill. What they found is that about 11 million people would be in the public plan, but many would be in private plans that would exist alongside the public option.
Now, we're basically talking about people that are not covered now having that option of a public plan. And the insurance companies don't cover them now. So what is the threat to the insurance company if there's a public option?
I don't think there is a large threat. I think, the individual insurance market now is fairly small. There will be a lot more people purchasing coverage in the exchange. So overall, there's a lot more people that they will have the chance to compete for their business, essentially. So as I said, the Congressional Budget Office did not find that that the majority of people would go into the public plan. They found that the private insurance companies would draw people. And the thought is, by having this option, there is more competition in many areas of the country. There's, one or two large insurers that dominate the market. This is a way to, in the long run, create more competition and bring down costs. And in fact, CBO, the Congressional Budget Office, also found that the public option would be about 10% cheaper than private insurance.
But these are people who are not insured now. These are people that the insurance companies are not covering now. So it seems to me that there really is no threat to the insurance companies. And the insurance companies have spent millions lobbying against this. And I have yet to understand why, since they don't cover this category of people right now.
I think that's right, in large part. I mean, there will be some, movement from individual health plans where they do cover people into the exchange, but overall, it really is a plus. This is by, bringing in and the coverage numbers for the House bill that CBO found was that, 97% of people would have coverage. That's very different than what we have now. So you're right. There's new business, and there's enough to maintain the private insurers as they exist. At the same time, create competition with a new option.
Is it truly possible then to make sure that affordable, quality health care is available to everyone with a new plan?